News Channel 5 network, this is MorningLine with Nick Barris.
Good morning, everyone. Thanks for joining us on MorningLine on this Wednesday. Great show on tap for you this morning as we continue to focus in on what's happening with the pandemic and the like. We're going to open up the phone lines. We're streaming live on Facebook at newschannel5.com. As always, it'll be a busy show. Later in the program, we're going to be joined by News Channel 5 legal analyst Nick Leonardo. We're going to get into some of the questions people have about their legal rights right now with regard to the pandemic, and some of the businesses now even suing the governor, and your legal rights, and also what's happening in the courts as things start opening up, because it's been pretty much shut down. So get those questions ready for Nick. But first, we're going to focus in on one of the most important things you can do to protect yourself from COVID-19, and that is washing your hands. The emphasis on that, and I think a lot of people, the message has come through loud and clear, but there are others, especially those perhaps younger among us, who aren't paying as close attention to that. And as a result, one way to get their attention, I think, is through music. And this a very interesting thing going on right now, and we're just very lucky to have the two guests joining us this morning from Harlem, the Columbia University Medical Center, and through the Hip Hop Public Health Institute there in Harlem. Joining us now is, well, first of all, we've got the human beatbox himself, a legendary rapper, joining us this morning, Dougie Fresh. It is good to see him on with us this morning, along with Dr. Olijade Williams. He's a neurologist with Columbia University Irving Medical Center there. Both gentlemen, can you both hear me?
Yes. Loud and clear.
Thank you so much for joining us. Let's start with you, if you don't mind, Dougie Fresh. I mean, we've got La-Di-Da, we've got the show, and now you've got something that's circulating nationwide now, 20 seconds or more. Tell me a little bit about this video and why you did it.
Well, first of all, thank you for having me on your morning show, and I just wanted to do something very special. Me and Dr. Williams been working together to try to get the word out to kids about taking care of your health, and your health is your wealth, and you get wealth from your health. So this pandemic happened, so we got with producer Artie Green, and we felt like, you know, let's put something together. Let's use hip hop as a positive resource to get the message out as far and as wide as possible. Then made a call to as many friends that I could in the music industry and beyond. And we got together and we put together a video where it was kind of like the We Are the World of washing your hands and saving lives. That's pretty much the concept and the idea, and it was a collective effort. And Dr. Williams fed us the information we needed to rap about. And we have been doing it all over the world now. Everybody's been washing their hands.
Has this video been sent out then to media? It's like a public service announcement. How have you distributed it?
So yeah, we distribute it by getting it out all over, because it's nothing, we're not making any money off of it. This is just a help the world video and record and concept, because the information we can provide is so simple, and it's something that you don't have to do. We're not asking you to do nothing extreme. We just want you to wash your hands for 20 seconds or more. Okay. And the doctor can explain why.
Doctor, we're going to get to you in a minute, and just stand by. What I want to do is give folks out there who haven't seen it, we have the video. We're going to play a snippet of it right now to give them an idea, and I think it's terrific. Let's show that snippet, and then we'll talk to the doctor.
Thank you.
What's good, y'all? This is Dougie Fresh, coming at you live and direct. All of y'all out there, I got a couple of things I want to talk to y'all about. Wash your hands, everybody. And everybody, wash your hands. 20 seconds. Come on, wash your hands, everybody. And everybody, wash your hands. My people uptown, wash your hands. My people downtown, wash your hands. People from the East Coast, wash your hands. People from the West Coast, wash your hands. That's right.
First and foremost, please listen close. Take your time, wash. Use a lot of soap from the front to the back. back to the front. Sing the hook where you at, that's exactly what we want. If you decide to leave.
All right, that is a little sample. That is a sample of the video. It's terrific. You see Cedric the Entertainer there, Ashanti, others that are in the video that runs about 3.5 minutes. You've got Jamie Foxx, Jordan Sparks, and others who have come out, Dr. Oz as well. Let me start with Dr. Williams here for a moment. And Doctor, the idea of this in a rap video, give us some perspective as to how you came up with this idea with Dougie and why you think it's important to target this audience.
Yeah, so thank you so much for having me on your show. You know, we're really excited to be there with you in Nashville and trying to spread this important message. And so one of the things that we know, one of the things that public health experts are very concerned about is the rate of asymptomatic spread of this disease. There is some data to suggest that up to 6 in 10 people that are infected by this virus are infected by silent carriers, those who exhibit no symptoms at all. And that's one of the reasons why this virus is very different to what we've seen with other viruses like SARS, for example, or even Ebola. Those particular viruses are typically very infectious when people manifest symptoms. But this is a different in an animal altogether. And so we have to really be very, very vigilant, and we have to exercise the highest level of personal responsibility by doing the things that we know are going to reduce its transmission. One of the things that we know about this virus is that it can live on surfaces for days. For example, on plastic and metal surfaces, the virus can live for about 3 days. On cardboard boxes, it can live for 24 hours. And so imagine, we know, for example, that the average person touches his face 23 times an hour. I'm going to say that again. The average person touches his face 23 times an hour. And often you're touching your face around your eyes, your nose, and around the areas of your mouth. A lot of times you're doing this unconsciously. You're not even aware that you're touching your face.
Well, let me ask you this, Doctor. Let me ask you this with regard to the hand washing part of it. Is the hand washing, in your opinion, as Dougie's singing there and rapping to, is that better than using some of these lotions and gels that, can be, antibacterial creams? I mean, how do those compare with hand washing?
So they both work. They both work. We know that if you have a 60% alcohol containing product and you sanitize your hands with that kills the virus just as effectively as hand washing. But the difference is that with hand washing, you're also able to get rid of of soils, under your fingernails, between the grooves, between the valleys of your fingers, and all of these areas that often the sanitizer doesn't get to. That washing your hands with soap and water for 20 seconds or more really does do a really comprehensive job cleaning your hands. But they are both effective, but in certain situations where you really want to remove the soil on your hands or the scrub and the scum on your hands, hand washing is superior to that. As a physician in the hospital, we use hand sanitizers all the time, but we have a rule that whenever we're dealing with soiled hands or we've been in contact with patients, that it's also with all the secretions from patients, it's also important to wash our hands first and then use the hand sanitizer after. So they're both effective, but hand washing is a much more comprehensive way to accomplish cleanliness when you do it properly for 20 seconds or more.
All right, let's talk a little bit more about this video, if we can, with Dougie Fresh. And you can hear the doctor tell it like he did, and he's straight on point, of course, there. And that gets out to a lot of us. The idea of having this video and putting it out with the audience you're trying to target, is there some concern that young people aren't paying as close attention, and this is one way to get them to hear that message, Dougie?
Yes, absolutely, because we know that sometimes people learn through song. As you know, I have a lot of songs that have passed generation after generation. I taught people how to do the Dougie from dancing, and so I thought about this and I said that if I did a video where people could wash their hands, it doesn't matter what age group it is, everybody would want to wash their hands, and especially young people, because You know, you throw on the music, the beat is nice, and you're in there and you're washing your hands before 20 seconds, or you may be washing them, you may wash them for a minute. You like the beat so much when you hear it, you know?
What was it like when you reached out to some of your friends, you know, the celebrities that joined you in this video, you know, Jamie Foxx and Asante, some of those others? I mean, what was their reaction when you asked them to do it?
You know, it's very interesting that you asked that, because I didn't get no pushback at all. A lot of them just sent me the video, and actually some of the videos came in and it wasn't as clear as I wanted it to be, and I had to ask again, and they were kind enough to send it again. And I tried to make it so simple that it was easy for them to do. If I asked them to get on the record and do a verse and sing and rap, and might have been a little more complicated, and considering that we're all at home, it was better to just do a video, and I appreciate them so much because it's been saving lives.
I think that's awesome. Real quickly, we have a lot of folks following us on Facebook as well as on the Plus here, and you know, several of them saying, "Yeah, Washington to the beat, what a great idea!" And they're saying, you know, they want you to come here to Nashville. Are you familiar with Nashville here? We're going to be playing the video, of course, and getting it out because it's a great message. But any message for the folks here in Nashville from you, Dougie?
Well, first of all, Nashville is one of the #1 music cities in the world for all styles of music. I've performed there before, and I'm looking forward to, after all of this is over, we're gonna have a party, but we're gonna wash our hands first, of course. You understand?
I love it. All right, as we wrap things up, Dr. Williams, last point from you. Just do you agree with Dougie on this? I think that the rap idea in the video is brilliant because it can target an audience that maybe is not always reached in this, the younger crowd. Can you talk a little bit about the importance of delivering the message you talked about earlier through music?
Yeah, so one of the things that Hip Hop Public Health does is that we have a scientific approach to creating content, to creating music and videos. We use what we've referred to as the multi-sensory, multi-level health education model. I'm not going to go into the science of that, but just to say that it's based on 3 basic concepts, is that about persuasion. You know, messages are most persuasive when they accomplish 3 broad things. One is that the message has to have credibility. The source of the message has to be credible. The messenger has to be credible. And we believe hip hop is a credible source for the youth, for young people. And using hip-hop messengers like Dougie also strengthens that credibility. The second piece is that the message needs to make sense. People need to understand exactly what it is that you're talking about. And this is where the data, the logic, the really explanation of what you're trying to accomplish comes into it. It needs to make sense. And the third is that there needs to be an emotional component, an emotional connection to the message. And hip hop, as you know, can really create, motivate, inspire all kinds of emotions. And the storytelling that you can build into song can also assist with that. So if you have those 3 things, credibility, emotional connection, and also a message that makes sense, those 3 ingredients is what science has told us. When you look at the science of communication, those 3 ingredients are critical for really getting messages across. And that is the formula that Hip Hop Public Health applies to all the content that we create. And we have a lot more content on our website, hhph.org. We have resources that Dougie and I and the entire team of our artists have been producing for health, different types of health information over the last 10 years. And I encourage your listeners to really explore that, and they can get all types of resources that can help them through this pandemic.
Awesome. Listen, Dr. Williams, I want to thank you so much for joining us. And you're lucky you've partnered here with one of the very best ever, Dougie E. Fresh. Really appreciate you joining us from Harlem this morning. And again, 20 seconds or more is the video. And yeah, you've got, you know, the human beatbox himself with a bunch of his buddies putting it together. Dougie Fresh. So a real pleasure and honor to talk to you both.
Thank you so much. Thank you for having us.
Thank you, gentlemen, for getting the message out, and we'll be following along as you guys continue to push that message. All right, we're going to take a break. Boy, that's pretty neat. Neat talking to both of them all the way from Harlem, but it's a message that applies especially here in Music City. When we come back, more of our conversation, some of your comments and the like, and then Nick Leonardo on legal issues right after this.
wash your hands. My people downtown, wash your hands. People from the East Coast, wash your hands. People from the West Coast, wash your hands. That's right.
There is